Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. Are you living it up?
I'm living it up. Are you?
Always living it up.
Well, that's terrific. So how will we get our listeners to live it up?
Well, I think the first thing they can do, if they want to get rid of musculoskeletal pain, that's orthopedic issues without surgery, is call us right now.
And
excuse my little scratchy throat.
that's okay. I will give the phone number while you cough.
You do all the talking today.
Okay, it's our number right here in the studio is 866-870-5752. That's 866-870-5752. And if you're new to the program, Dr. Darrow will be teaching you today about what regenerative medicine is as an alternative to most elective surgeries, not emergencies. So our show is focused on orthopedics, that's musculoskeletal pain. And if you didn't know what chronic pain is 3 months or more of being in pain. And you know, Dr. Darrow, many of our listeners call they've been in pain like 10 years, 20 years, 30 years, not just like more than 3 months. So it's a pretty big deal that if you're listening to this program and you call in today, it could be life-changing for you. It could be. Because,
Nita,
yes.
Nita, that's amazing. You don't even need me here.
Yes, I do.
I'm going to give out the phone number so we can get some
go
callers.
for it.
Because that makes the show really interesting rather than us just blobbing. Yeah. So write this down. I'll be talking slow today. And the reason is I had a cardiac ablation 3 days ago.
Really?
And yeah. They put me to sleep with an endotracheal intubation. So that makes the throat a little bit scratchy for a while. I'm doing real well. And it was for atrial fibrillation.
My goodness.
And there are so many people that have that. I'll give out the phone number and then I'll talk a little more about that because it's so prominent.
Okay.
The phone number is 866-870-5752. I'm going to repeat it for you while you write it down or dial it up and talk to us live. If you're having any kind of orthopedic issues, which can be neck pain, back pain, hip pain, shoulder pain, knee pain, finger pain, bottom of the foot pain, doesn't really matter. All these syndromes, meniscal tears, arthritis, rotator cuff tears. What we do here with stem cells and PRP, platelet-rich plasma, is we do simple injections which stimulate the tissue to grow back and heal and rejuvenate it, rather than having a surgery that can be very traumatic to the body. So once again, the phone number to talk to us live, 866-870-5752. And if you want to get a hold of someone at the office anytime, the phone number there, and by the way, you can call this number, get a free consult with my staff and see if our treatments are applicable to you. And the phone number to the office is 800-300-9300, 800-300-9300. And go to the website. You can watch these procedures on videos, and you'll get to see video of Dr. Thomas Grove, who is my new injector. My hands have gotten sore after doing this work for 25 years. And Dr. Grove is amazingly well trained. I wasn't really trained. I just intuited how to do this work over the last 25 plus years. But Dr. Grove actually had a fellowship in doing regenerative medicine, and he's been working at this for the last 12 years or so. By the way, he played linebacker for the Cornhuskers.
Oh, wow.
So he's a big dude, very handsome guy, very fun to be with. Brilliant guy. He knows everything about medicine. So when you call up and you ask for me and they say you're going to be dealing with Dr. Grove, please don't be upset. I'll be around. But it's Dr. Grove who is now doing the injections. So if you want to see him, you can look at a video on www.jointrehab.com at the bottom of the first page. That's our website. So I was talking just a second about cardiac ablation.
Okay, and I just want to let you know we have a caller on hold, too.
All right, great.
Okay, go ahead.
Well, I'm going to get to the caller first, so
Okay.
we don't have anyone have to wait. Barney, we're going to go to you. It's about your back and your trunk. Tell me about the trunk. What's the trunk?
Well, I think it's everything from my hips up to my shoulders.
Oh, okay.
I don't know if that's a proper term, but that's what I'm using.
That's okay. We don't care about the terms. We care about you explaining what it is. And what is it that's going on? Have you injured yourself, or do you work out too hard, or what is it?
Yeah, I twisted. I was just walking at a restaurant. The floor was wet, and I twisted. I didn't fall.
Yeah.
I twisted.
How long ago was that? How long ago was that, Barney?
I think it's just now 4 weeks.
Okay. Is it starting to get better, I hope?
It's changing. I probably is putting up with it more is what I'm doing.
Yeah. You know, you're the guy that I have to examine, or Dr. Grove would have to examine, to see where the pain is actually coming from and see if regenerative medicine of stem cells or platelets can help you heal. That's a big area, and it makes sense that you would be hurting after slipping on a floor and twisting your body like that. But until you're examined, we don't know specifically what it is going on. And that's really with anything. You know, we get people that send us x-rays and MRIs and CT scans, and they say, "Can you help me?" And I always respond with, "Probably, but I don't know until you have an examination," because the images give false ideas about what's going on. So I'm pretty sure we can help you, but I don't know positively until your body is examined. So if you want to come in, the phone number to the office is 800-300-9300, 800-300-9300, and there are people there by the phone right now. If you call in, you'll get a free phone consult with my staff, and they'll tell you if they think we can help you or not. That's the best way to start. They'll get into more detail than we can do on the radio.
Sure sorry about Suzanne Summers.
Oh my gosh, that's
a real loss.
Real loss for, thousands and thousands of people. She's helped so many people over the years. She's dedicated her life to helping people heal naturally without surgery. And we are so saddened, and we give our condolences to her husband Alan, her son Bruce, and her grandchildren and friends. And God bless you, Suzanne Summers, and your soul, and everybody involved with you. Thank you for mentioning that. It makes me very sad.
Thank you, Barney.
Yeah, throw your office number at me one more time.
Sure. It's 800-300-9300, and there are people there right this second who can give you a free phone consult to see if we can help you.
Okay, I'll call it.
All right, Barney. God bless you.
Thank you, Barney.
Okay, thank you.
So I'm going to give out the phone number again, and then we're going to get to Linda. Phone number to the studio, talk to me live, 866-870-5752, 866-870-5752. So Linda, your hip and your lower leg are bothering you, and I'm wondering if you've been to a doctor yet.
Oh my gosh, yes I have. I've been to a few, including having a son-in-law that's a spine surgeon, orthopedic spine surgeon. So had an MRI of my back, had an MRI of my hip, had a hip X-ray, and nobody wants to call this anything, but I definitely have something going on in my glute and hip area.
Okay. So, number one, when we say the word hip, it doesn't really define what we're talking about. So that's an area I'd have to examine, or Dr. Grove actually would examine, and he would be able to touch the area and tell you exactly what is going on and if we can heal it. If it's the gluteus muscle where it attaches to the pelvis, we do those almost every single day and heal them up. And the reason no one knows what to do with you is because your MRIs don't tell us what to do.
Right. Okay.
The hands have to tell us what to do, meaning the examination. And I want to tell you, Linda, that's the best news you could have, that the MRIs don't give out the secret of where your pain is being generated from. That's a very good indication that we can help you heal.
And the answer might be an injection into that area with stem cells or PRP.
I'm pretty sure that's going to be the answer for you.
Okay. And then I have a list of things, but I had rotator cuff surgery in 2015, and I'm an avid tennis player. Thank goodness I can still play tennis, but not without. Definitely, I have restricted movement, but I'm older, and what they want to tell me is, Linda, you've got arthritis, and you just have to live with that. What's your thought on that?
Well, my thought is against the traditional medical system, as you know. I'm not for traditional medicine if you can use something natural that can heal you. Now, if you're dying, you go to the intensive care unit, and that's where you got to be. They'll give you medications, whatever it is. If you break a leg and the bone is sticking out, you need a surgeon. But for most of these things that you have, it sounds to me like we can heal you naturally using stem cells from your body or using platelets, PRP from your body, and heal you without surgery. You already had a surgery that failed.
Right.
So don't go that path again.
Yep. I'm really not interested in going that.
I had the same thing when I was in medical school, my fourth year of medical school. I had a weightlifting injury, stretched out my shoulder, and I was doing orthopedic surgery at the time, and I loved my professor, and he did a surgery on me, and it blew up my arm and my shoulder. I had 4 years of misery after that shoulder until I learned about regenerative medicine, and I injected my own shoulder. That's right, I do my own injections. Injected my own shoulder.
I heard that story earlier.
Okay.
Yeah.
And I woke up the next morning 100% pain-free with full range of motion. And I don't want to give people the idea that it's a one-treatment fix. I've been very lucky. Regenerative medicine has healed so many parts of me. I've injected my both knees, both elbows, my right wrist, both shoulders.
Did you inject them prior to you having issues? Or
No.
Were they all showing some?
No, they're all from injuries. Yeah, all from injuries or overuse.
Yeah, well, I have a lot of those. So
and
being
also,
that I'm 73 years old and have played tennis most of my life at a high level. So
well, I hear you.
Maybe it's the answer.
Well, you won't know until you call the office and get a free consult
and get
over the phone.
A consult. Okay.
Yeah. So the number there is.
I think.
Can I talk for a sec?
Yeah. Sure.
Okay. Thank you so much, Linda. So the number to the office, and you can talk to someone right now, is 800-300-9300. I'd start there. The second place I would go is to the website, which is www.jointrehab.com. And there's videos of me injecting shoulders there. And there is a spot where anyone can email me on every page. And I think we can help all these things you have. I won't know until Dr. Grove examines you, though. I'm pretty sure, but until you have an examination, we're not going to know. So when I had a shoulder surgery, an acromioplasty was done, which is the top bone of the shoulder. The acromion was cut. It was actually part of it was cut off. That didn't do a darn thing to help me, and some ligaments were cut. My shoulder blew up like a balloon, and my arm blew up like a balloon full of fluid, and I had a fever from the surgery. This is not uncommon stuff to happen. We get people in the office almost every single day who have had failed surgeries. Okay? So this is not a statement against surgeons. I love surgeons. I was on my own path to become an orthopedic surgeon until I had this one on my own shoulder, and then decided I don't think this is good for people. So the surgeons are very smart guys.
Can you give me your website one more time?
Yeah, get a pencil. It's ready. www.jointrehab.com.
Okay.
You'll learn everything you need to know about regenerative medicine, of stem cells and platelets there. I've probably done more of this than anybody on the planet, and Dr. Grove is right up there with me. And I'd be very careful about reading the internet, having information written by guys who don't do much of this, who are making stuff up.
Yeah. All right. Thank you, doctor. I appreciate it.
God bless you, Linda. I think all of these things, could be healed that you have. And I think you can get back to being a top-level athlete again. I'm 75.
Good.
I'm still sprinting up and down the mountains where I live, and I play golf, I lift weights, and I wouldn't be able to do a darn thing if it hadn't have been for stem cells and platelets. I really wouldn't. So 30-some years ago.
That's a good acknowledgement to giving it a try. So thank you.
30 years ago, I was a mess. I had so many injuries I couldn't do anything. I'm back to it now. I'm in great shape, and I just thank everything for being a doctor who learned regenerative medicine, and I can do it on myself. So I've been very fortunate. God bless you, Linda. It's great talking to you.
Thanks, Linda. And our number is?
I'm going to give out the number to the studio so you can talk to us like Barney and Linda just did. And the number here, and we love our callers, is 866-870-5752. So I just wanted to mention again what cardiac ablation is, because so many people are afraid to do it, and they're stuck in atrial fibrillation, which actually damages the heart. So as soon as I found out that I had atrial fibrillation, I scheduled an appointment with a doctor to have it done. And I'm very, very happy. I used Dr. Eric Bush at UCLA. I checked around with other doctors. I liked a few. Some I didn't really like. You have to find someone you love, and that's important with anybody. If I ever recommend you to get surgery, because I do occasionally recommend my patients to get surgery, it's very, very, very rare, because most people we can heal with using stem cells and platelets. But there are those occasionally I send to a surgeon, and the one I send to is the guy who does the most. That's important. You always go to the doctor who does the most of what you are looking for. So there are a few guys out there, there's a few surgeons that are well known to do the most, and that's where I send my patients to. And that's why I get a lot of referrals from doctors, because I do the most regenerative medicine of anybody probably in the country from what I know of. That's what they tell me. I'm not sure, but we are busy all day, every day. And, you have to make your own choice. You have to love your doctor. It's very important to fall in love with your doctor and feel good about it. I was actually recommended to have this cardiac ablation by a doctor who has, what I was told by this referring person, has a terrible personality. And she said, but don't worry, he's a great surgeon. And I was like, I want a great surgeon, but I need somebody I can talk to. So I opted out of seeing that guy. And I chose the guy that not only was a great surgeon, but had an amazing personality. So that's up to you. Some people don't care. I care. I want to be loved by my doctor. And that's pretty much what we do the best to our ability with our patients. If you look at my Yelp reviews, I think you'll see that we are very loved. And I think that's important to have a good staff that answers the phone, answers your questions, and spends time with you. Because part of healing has to do with touching and feeling and loving and the psychology of being a good person. And we work at doing that. We don't satisfy everybody. There are some people that are very difficult to satisfy, and God bless them also. They need more love than anybody else. All right, so let me see where I'm going here.
Do you want to give the phone number again and talk about what else goes on in the office for a minute?
Yeah. So we also do what's called the vampire facelift, where we inject stem cells or platelets into the face and regrow the collagen and make you look younger again. As we age, the collagen all over our body dries out. That's in the discs in the spine, in the cartilage, it's in all the joints, but it's also in the face. So if you want to look better, this is men and women, we do the vampire facelift, where we inject stem cells or platelets into the face and you look better. It regrows the collagen, makes you look younger. And then also we can assist in waking up the hair follicles on the head. If you're starting to lose hair, come on in. We put the platelets or the stem cells actually into the scalp and can grow some hair back. So those are great things to do. And any type of musculoskeletal pain you have from head to toe, neck pain, back pain. I actually had my entire spine injected. At one point, all my ribs. I was a gymnast when I was young, and no one told me I'd be sore afterwards.
Wow.
We did all kinds of crazy stuff. And after working out for hours a day, we'd have weightlifting contests. And, we weren't very smart back then. We know now that over-exercise can cause a lot of pain. We get a lot of patients with overuse syndromes, and regenerative medicine can help heal them up. So, Nita, if you don't mind, I'm going to go to some questions here.
Sounds good.
Here's one. Doctor is recommending right shoulder replacement surgery. Oi! Let me read this. My orthopedic doctor is recommending right shoulder replacement surgery. I've already had my left shoulder replaced and wasn't happy with the results.
Ouch.
Are you able to help without surgery? I'm right-handed and still fairly active in sports, and would hope I'd be able to continue playing sports, pickleball and softball without limitations. I'm 69 years old, if that is any bearing on your input. Not really. Age has nothing to do with regrowing tissue, in my experience. I've treated people 100 years old, I've treated tons of people in their 90s, even more in their 80s and 70s. I treat kids. We have a lot of high school athletes. Hang with us, and we'll be right back with you. Give us a call at the studio at 866-870-5752.
And check out the website at jointrehab.com, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles.